Everybody to FitFoot U. It's Dr. Ben Pearl, and I'm honored to have the privilege of hosting tonight's Biomechanics Summit 22. We've got a couple great speakers, and we're going to get started first with some opening remarks. This has been a group effort, truly. First, I want to thank the Academy of Podiatric Sports Medicine. I also want to thank Dr. Steve Privet, who did a lot of work on the back end. I also want to thank all our speakers, Ben O'Nig, Richard Blake, and Young Lee for his involvement with this. And we're going to hear a few words from him. So we're going to have some opening remarks here from Steve. Steve, we should have you be able to grab the floor, and then we're going to get Benno up next. So Steve is just going to give it some overview comments, and then I'm going to introduce Benno after Steve. Let me just get Steve back in here.
Yep, I'm here.
Okay, go ahead, Steve. You got the floor.
Okay, so I'm given 5 minutes, so I can barely get my one joke out, which is a hominid walks into a biomechanics lab, but I don't have time for the rest of the joke. So we start off knowing that all models are wrong, but some are useful. A fellow named George Bach said that. And we also can cite the often mentioned Thomas Kuhn's The Scientific Revolutions, in which he talks about paradigms. So basically in biomechanics at this point, we're beginning a new paradigm or a series of conflicting paradigms. That's the old paradigm is broken, lost, and root biomechanics are dead. There's something wrong with the screen.
No, it's just people are not muting and
yeah.
Yep. Okay.
As host, can't you just mute everybody?
As they come in, I can.
Okay.
As they come in.
So we once had a very simple paradigm, which was root biomechanics of sorts. And it wasn't all invented by Root. A lot of it was taken from Mann, Elthman, Hicks, and a series of other people. But we've moved on. So we've moved on for progress's purposes. And I'd say Kevin Kirby was one of the driving forces of that. Around 2000, 2001, he wrote an article in JAPMA that was a significant criticism of the flaws in root biomechanics. And as Kuhn has said, when paradigms are examined, often flaws are found. And when flaws are found, you need to start looking at a new model. So what have we left, or what have we moved on to? Or first, let's look at what's no longer important. So the mid-tarsal joint, oblique, and longitudinal axis are no longer critical theory. So we have to figure out, do we have one longitudinal axis, or do we have a series or a bundle of axes, which some people have posited? Likewise, the subtalar joint neutral is something that's difficult to have inter-observer agreement on, and the exact axis is very hard to calculate. It's easier to calculate the axis that the Earth spins on. Does the mid-tarsal joint lock? The current theory says no, but motion is limited because the navicular and cuboid move together as a unit. Also, the criteria of ideal normalcy is no longer in effect, but we do have rotational equilibrium about the subtalar joint and tissue stress theory. Now, tissue stress theory is not something new, and it wasn't new when it was first written. It was basically what I learned from Richard Schuster, who never called it that. And we have a few other things, many of which Ben O'Nig has worked on. So,
do you have a favorite, Steve? What's your favorite theory? Because you've been reading a lot about Benno lately.
Oh, I'll come to that in a minute. So in order to learn the current thoughts on biomechanics, it requires an ongoing effort because it's always in flux and change. The study next month is going to conflict with something that came before. I was listening to, I believe it was Lance Kelly, who was talking about intrinsic muscles. And he went from saying that the intrinsic muscles had no impact on longitudinal arch to having studies that showed that it did. He looked at it as something that helped the body to spring forward. However, he also did find with later research that it has an impact on the longitudinal arch. So dropping back to understanding the basics, though, is also important. So I encourage everyone to learn what a moment is. How a joint axis is not something that's actually rigidly inside the bone, but it's a result of constraints and joint and bone morphology, meaning shape, and also kinetics and kinematics. And make sure that the Dunning-Kruger effect isn't playing a role with you thinking that we know more than we do. although I can note that the popularity of biomechanics and the understanding of it decreased as our simple model dissipated. Later, Richard Blake will discuss his approach, which is quite agnostic to a specific theory. And we should remember that clinical reality is more important than biomechanics theory. But next up, after Ben introduces Benno, I've got a couple things that I liked of his concepts. So one, kinetics, which are moments, plays a greater role than kinematics. Kinematics is motion that gets described. And muscle tuning also plays a key role in biomechanics. And he also has pointed out that comfort is important in shoe and orthotic selection. Small muscles are important and play important roles because they may have favorable moment arms for action. And also his development of the concept of preferred motion pathway, which is now in evolution. And I look at it as a more optimal.
Human ankle joint has a lot of muscles crossing it. As a matter of fact, a lot of small muscles, and then a very big one, the triceps surae, and kind of a big one, the tibialis anterior. And the question is, why do we have so many muscles here? What is the functional reason for these muscles? In order to understand the functional reason for these muscles, we look at a cross-section here through the ankle joint. And these pink areas these pink areas here indicate where they have the insertion. And we want to understand what these muscles do with respect to the two axes that we have in the ankle joint axis and the subtalar joint axis. And as I said, the goal is to understand the function of the small muscles. So let's theoretically assume that we wouldn't have them. So let's assume we don't have them, and the only two muscles that we have left is the tibialis anterior and the triceps surae. And we see what these muscles can do with respect to the two axes. With respect to the plantar flexion, dorsiflexion around the ankle joint axis, we see we have these muscle insertions, the tibialis anterior and the triceps surae, and they have a nice distance to the ankle joint axis. That means they have a good lever. Now, the force in the triceps surae, which is the Achilles tendon down here, can be very high. And the distance here is very high. So this force times the distance produces a moment, and the moment is very big. The tibialis anterior has a smaller force and a smaller lever, but it's still good. So with respect to the ankle joint axis, these two muscles could solve the problem quite nicely. What about with respect to the subtalar joint axis? Now, the tibialis anterior can do something with respect to the subtalar joint axis. It's not very good because the distance is small. So the moment it can produce is small. So it can produce a small supination. And the triceps surae could produce a small supination as well as a small pronation. That means the muscles, the large muscles that we have, the tibialis anterior and the triceps surae, are weak supinators and terrible pronators. So let's take an example for the pronator. Let's assume we want the foot to pronate. That means we pull up here. Now, this is quite difficult because the triceps surae, if we activate it symmetrically, the triceps surae produces a moment as a supination and a moment as a pronation. So what we have to do, we have to activate the triceps surae asymmetrically with high activation on the lateral side and no activation on the medial side. That looks somehow like that. So on the medial side, we have low activation. On the lateral side, we have a high activation. And that means that we produce forces in the Achilles tendon, which are huge. And I mean huge. These forces can be between 20 to 40 times body weight. So that's about 20 to 40 tons. It's terrible. And of course, that may be the reason for some injuries. So if small muscles are not present, or if small muscles are weak, the large muscles must take over, and they are not well done to do that. They produce asymmetrical Achilles tendon load, and they can produce high local forces. And as I said, 20 to 40 times body weight. So if you have problems in the Achilles tendon, especially on the lateral side of the Achilles tendon, the most likely reason is that your small muscles are too weak, and we have to do activation of the big muscles to stabilize ourselves. So that means we have to do training for the small muscles. How can we do that, and what is important? From my point of view, the best training that you can do is what I show here on that video. You stand on an unstable surface, you clean the teeth, and you go a little bit up and down, not much, just about 2 inches. And the cleaning of the teeth is important to make yourself unstable. That you have to control yourself and correct yourself. We did some studies with some elderly men that had knee pain. And in more than 50% of all the cases, just doing this exercise, they had a reduction of their pain. And they had clean teeth too. You can also do isometric training. Important is that you do it in all directions. So backwards, forward, left and right, and up and down. And if you do it very seriously, you do all the rotations that you can do. Do it isometrically. Do it dynamically, it doesn't matter. Maybe 10 seconds, the maximum force, but very intensive. Or you can do it with your neighbor. We also found that unstable shoes like the MBT that we see here are good for that training. As a matter of fact, the training of the small muscles is, in my view, the most important strategy that you as podiatrists can use to deal with problems in the lower extremities. And that is not just Achilles tendon problems, it's problems of plantar fasciitis, problems of knee pain, whatever. Almost everything can be treated with that intervention.
And I want to clarify, Benno, you're referring to small muscles which cross the ankle, correct?
Right. But the same is true if you talk about the shoulder. Now, I feel very strongly about that, and I have a nice anecdote to finish my explanations. This was an athlete, it was his last season. He was Swiss champion with quite some reasonable times. As a matter of quite some good times. And he phoned me one day and said, you know, can you help me? I have Achilles tendon problems. I can barely move. I can certainly not train at all. And I tried everything that I could, nothing helps. And I said, you know, I'm not a doctor, but I can look at the whole thing biomechanically. So I saw him and identified that, in my view, his small muscles crossing the ankle joint were very weak. So I composed a training for him that he did about 1 to 2 hours a day. He was a professional athlete, so he could do that. And it included all these things that I just said, you know, it included the MBT shoe, included the cleaning of the teeth with going up and down on unstable surface. It included isometric exercises and so on. He religiously did the training, and after 3 weeks, he called me and they said, I'm pain-free, I can train again. 3 weeks. And 2 months later, he was fourth in the 5,000-meter European Championship. So the problem obviously was solved. Now, this is not a proof, so it's just a nice story and indication that it could be right. But my feeling is that by training the small muscles crossing the ankle joint, you can solve many, many problems dealing with your field, the podiatry field.